Welcome. Today, we're diving into the analytical challenges involved with liposomal and nanoparticle injectables. These complex drug delivery systems offer exciting possibilities, but they also bring unique hurdles in analysis and quality control. Let's explore what makes these challenges so critical and how we can address them effectively. Today, we're diving into liposomal and nanoparticle injectables, advanced drug delivery systems designed to do more than just carry medicine. These formulations improve how drugs target cells, boost bioavailability, and enhance stability and effectiveness. You might recognize examples like Doxil, M-Bisum, and the lipid nanoparticles behind mRNA vaccines. These particles range in size from about 10 to 1,000 nanometers. Because of their complexity, analyzing them means using several different techniques to fully understand their structure. When we talk about global regulatory expectations, we're looking at a complex landscape shaped by key agencies around the world. The U.S. Food and Drug Administration and the European Medicines Agency set important guidelines. Then, there's the International Council for Harmonization, which helps align standards internationally. Their focus is clear. They want us to pay close attention to critical quality attributes like particle size distribution, drug encapsulation, stability, and product comparability. These factors ensure safety and effectiveness across markets. When we talk about critical quality attributes, or CQAs, we're looking at the key factors that define a product's safety and effectiveness. These break down into four main groups. First, biological attributes, things like sterility, endotoxin levels, and immunogenicity, which affect how the body responds. Then, performance attributes, how the drug releases, its stability, and where it travels in the body. Physical attributes include particle size and shape, while chemical attributes cover drug content, how well it's encapsulated, and any impurities. Each one matters. Let's talk about particle size, a key factor that impacts how drugs behave in the body. It influences pharmacokinetics, biodistribution, cellular uptake, and even stability. To measure particle size, we rely on several techniques. Dynamic light scattering is the most common, giving us quick averages. Nanoparticle tracking analysis lets us track individual particles, while laser diffraction handles larger populations. Electron microscopy provides detailed images to confirm shape and structure. The challenge? Aggregates can skew these measurements, making accuracy tricky. Here, we see a simple table showing particle size measurements in nanometers. 5 separate readings range from 98 to 102 nanometers, all tightly grouped. This slide gives us a clear example of how dynamic light scattering helps calculate particle size. By taking multiple measurements, we get a reliable average, which is crucial for understanding the consistency and quality of the particles we're studying. It's a straightforward but essential step in our analysis. Let's talk about the polydispersity index, or PDI, which tells us how uniform our particle sizes are. Here, we have an example with a measured PDI of 0.18. That falls within the acceptable range, meaning our particles are fairly uniform, ideal for injectable use. A high PDI, though, could signal problems like aggregation or instability in the formulation. So keeping the PDI low is key for quality and regulatory approval. Let's talk about zeta potential, a key indicator of how stable a colloidal system is. When the zeta potential is plus or minus 30 millivolts or more, the system is highly stable. Between 20 and 30 millivolts, it's moderately stable. But below 20 millivolts, there's a risk of particles clumping together, or aggregating. Measuring zeta potential can be tricky, but it's essential because it tells us how likely a suspension is to stay evenly dispersed over time. One of the key challenges we face is encapsulation efficiency. This is all about how well we can trap or contain the desired material within a carrier or system. If efficiency is low, we lose valuable resources and the performance drops. So, improving encapsulation means better delivery, higher impact, and less waste. It's a critical hurdle, and solving it can unlock the full potential of our approach. Now, let's turn to a key challenge in pharmaceutical development, drug release testing. This process is all about understanding how a medication releases its active ingredients over time. It's crucial because it directly impacts how effective and safe a drug will be once it's inside the body. But testing this accurately is complex. It requires precise methods and careful analysis to mimic real-world conditions. Getting this right means better treatments and improved patient outcomes. Now, let's dive into the analytical challenge of morphological characterization, understanding the shape and structure of particles. We use several key techniques here. Transmission electron microscopy, or TEM, lets us see inside the particles, revealing their internal structure. Cryo-TEM takes this further by imaging them in their native, hydrated state. Scanning electron microscopy, or SEM, focuses on the surface details. Common issues we look for include aggregation, fusion, collapse, and deformation of particles. This analysis is crucial for regulatory purposes, helping us prove comparability and ensure stability over time. Now, let's dive into stability indicating assessments, a crucial part of understanding how a formulation holds up over time. We look at potential degradation mechanisms like particle aggregation, drug leakage, lipid oxidation, hydrolysis, and changes in surface charge. To track these, we measure parameters such as particle size, polydispersity index, encapsulation efficiency, and potency. For example, if particle size grows from 100 to 130 nanometers over 6 months, that suggests aggregation is happening during storage. This insight helps us improve stability and ensure effectiveness. When working with nanoparticles, sterility and endotoxin testing come with unique challenges. These tiny particles can actually interfere with standard microbiological tests, making accuracy tricky. So we rely on a set of essential tests: sterility, bacterial endotoxin, subvisible particles, and container closure integrity. For example, an endotoxin result of 0.08 EU per milliliter, well below the 0.25 limit, shows compliance. This ensures safety and quality, even with these complex materials. When regulatory inspectors come knocking, they zero in on a few key areas. They want to see solid method validation, a thorough characterization package, reliable stability data, consistent manufacturing, and clear batch comparability. Common pitfalls: inadequate particle characterization, weak method robustness, too few stability studies, and missing orthogonal analytical methods. The best way to stay ahead is by embracing quality by design and a risk-based development approach, building quality in from the start, rather than chasing it later. We've covered a lot about liposomal and nanoparticle injectables, highly complex drug delivery systems that demand thorough characterization. Key quality attributes include particle size, distribution, surface charge, shape, how well the drug is encapsulated, and how it's released. No single test tells the whole story, so we rely on multiple complementary methods. Stability is crucial, too, watching for aggregation, leakage, oxidation, and growth. Regulatory bodies expect detailed, science-backed specifications. Strong analytical strategies keep these products safe, effective, and compliant. Thanks for joining me today. If you need any more support or have questions, don't hesitate to reach out. I appreciate your time and attention, and I look forward to what we'll explore next together. Thank you.